We note the presence and amount and color and smell of any exudate. Granulation tissue means healing, and I'll show you what that looks like. Epithelialization, you'll see at the wound edges. It'll be pink, and it means the epithelium is recreating. It's a good sign. And then we have to note if there's any exposed tissue of other types, whether it be fat, bone, tendon, ligament. Tendons are very white and shiny.
Iridescent. I mean,
okay, so how are wounds going to close?
Outside edge.
Okay, so wound closure is referred to as intention. So first we have primary intention. A wound closes by primary intention when it is a slit. So if you're cut open surgically, if you're lacerated, cut by a knife, and it just means that basically the skin has split and you can just squeeze it back together.
Yep.
Okay, so that's when you're going to get stitches or staples or sometimes just skin glue, and it can just close up again.
Do that.
It works.
You don't do any stitching.
No.
Craggle.
And there actually is, well, we do debridement, which is removal of dead tissue. And physical therapists can perform sharp debridement with scalpels and scissors and forceps, but PTAs cannot. But you can do every other type of debridement. One wound care rotation.
Did you gag?
I just almost fainted a whole bunch of times.
You were like, let me nibble that off for you.
Oh.
I mean, it was nice because I was working with a PT to PTA, and they were like super excited about it. Yeah, once they were like, oh, look at this exudate, and like put it in my face, and they're like, oh, sorry, I forgot you were screaming. There she goes. I never did pass out, it was very close. It always was easier when the patient couldn't feel it for me. The patient was in pain, that made me like more like
Tiger got out of its cage.
okay, so secondary intention is, if we're going to treat a wound in the clinic, it's most often going to be secondary intention. So secondary intention is there's been some sort of tissue loss. Okay, so this was just a split or you can push it back together. Nothing was actually cut out. Secondary intention, there's been some sort of tissue loss. So like if you fall on the ground and scrape your knee, you've left some of your skin on the ground. So that wound is going to heal by secondary intention. Okay, if the tissue is eaten away by some sort of vascular ulcer, it has to heal by secondary intention. Now, it's called tertiary intention when the wound basically needs some help with the healing process. So it's still secondary intention, but it's delayed.
What do you mean, like a third-degree burn?
It just means the wound healing is delayed. It can be primary or secondary. Just needs some help along the way.
Like
that's both the wounds we're going to see.
Like a massive laceration or abrasion, or is it?
Yeah, or someone who has a vascular issue or is malnourished or things like that. Okay, so why is there abnormal wound healing?
Circulation, improper circulation.
Okay, so if the patient does not have adequate circulation, that is going to delay wound healing. If the patient has an infection in that area, it will delay wound healing because the bacteria is going to come in and eat stuff. What else? Nutrition. If you don't have adequate nutrition, all those vitamins and minerals, that will delay wound healing. Moisture, if it's too wet or too dry, it will delay wound healing. Oxygen, which is usually related to the circulation. There are cases where patients will be put in a hyperbaric chamber to try to speed the healing process along, but those are large and expensive and uncommon. For that reason. Okay, if there's dead tissue in the wound bed, that, like I said, it's going to block the oxygen from getting to the wound. It will delay wound healing. Now, infection is always tricky because you have the risk of it spreading either systemically, which would be sepsis, to the bone, osteomyelitis, or turning into gangrene, which means you're getting an amputation. Same if it ends up in the bone. Not at all. Okay, we also mentioned swelling, so excessive presence of edema will also delay wound healing. And then again, any sort of systemic infection, which will give someone a fever, or give systemic dehydration, that will delay wound healing as well. Okay, so abnormal wound healing is usually classified into intrinsic versus extrinsic factors of everything we just listed. So no, intrinsic are conditions within the body, like if they have decreased circulation. Extrinsic are external influences, like someone not having their position changed, so they develop a pressure ulcer. So these are, you can modify the environment to make a difference on the extrinsic factors.
Maceration be included in extrinsic, or could it be in both for different reasons?
It depends on the reason of the maceration. If it's because of the wrong dressing, then that would be extrinsic. What came up again?
Oh, recreational drugs.
They're
Well,
fun.
because it's I can look at other people.
Wait, what?
I was looking at you.
Yes, smoke.
I don't think so.
Yeah, Ron smokes. It's not at school. Smoke like.
Closet smokers.
Yeah. Oh, when he's drizzed on.
Okay, iatrogenic factors are because of injury or illness.
Like I smoke, yeah.
So, in medical care environments, so like MRSA, so if they get a hospital-acquired infection of a wound, or cross-contamination. So that's why when we start doing wound care, it's all about maintaining a sterile field. Remember when we went into the crazy surgical tech room and they were kind of like throwing things on the table? So you're going to make sure nothing in your hand touches your sterile field. Lots of pass-fails. That's why we're going to practice. Hold on. Watch out for those trash cans.
Thank you.
You drop it in the trash can, it's done. It touches the trash can.
It's done.
You touch the trash can. You're done. If you touch yourself, you're done. If you touch the table, you're done. You don't touch anything. That's sterile.
Don't touch the strippers.
Okay, so recognizing why a wound is failing to heal. Hey, if it's too dry, it means you need a dressing that can retain moisture. If the wound does not change in size or depth for 2 weeks, there's either an infection, poor circulation, or some sort of pressure in that area. If the size of the wound gets larger, that's real bad. It means there's definitely not any circulation, or there's an infection, or there is necrotic tissue that has not been removed. I'm sorry, not, well, so sometimes you'll start treating a wound and have certain measurements for it, but then some of the tissue was gonna die and it finishes dying, so then you can remove it. And you remove it, now the wound actually is bigger. But that's just because you removed the dead tissue. It's not actually a bad thing. Okay, if there's necrotic tissue, it means that tissue was ischemic and you need to remove it. If there's an increase in drainage, it usually indicates infection. And we're going to talk about the different colors of exudate and what it indicates. Purulent is green and smelly and thick and means infection. Versus clear would be called serous, and that's not a bad thing. Tunneling means there's some sort of pressure, or there's a deep infection, or there could even be a foreign body inside the wound. Okay, if the skin is red and hot and tender, it means there's inflammation, either from pressure or infection. Maceration, like I said, is white. And it means there's excess moisture. If the skin edges are rolling in, undermining, means it's too dry, you need more moisture. If the peri wound becomes too red, it means there could be shearing forces on that area.
How do you re-moisturize the wound?
You use a different type of dressing that will retain moisture. But also, every time you clean the wound, you use sterile saline, so you're adding in moisture to it anyway.
Gotcha.
It's all about the type of dressing. No. Yeah, the only thing the doctor would order is if you're adding in something something topical to treat an infection. Other than that, it's up to the physical therapist. Okay, I already mentioned all that. Oh no, let's listen to this. Okay, so the older the person gets, the slower their wound healing is going to be. Stand up.
This has got to do with my old wound.
You want to get pressure ulcers on your ischial tuberosity? Thank you. Okay, reach up.
My tooth!
And bend over, touch your toes.
I'll touch the
Oh!
And straighten your knees a few times.
Hey.
Slowly roll up.
It's funny if I do that.
Reach one arm up overhead and to the side. Good. And up and over to the other side.
Breathe segmental.
Stretches the other side twice.
Good. And step one foot back. Close to your pelvic tilt.
Oh, hold on, I got nothing but French butt on you.